Memphis. This is News Channel 3 at 4.
Topping the news at 4, on the heels of today's promising announcement of a second COVID-19 vaccine that's more than 94% effective in preventing the virus, a Memphis nurse became the first person to test a new antibody therapy locally. Thank you for joining us, everyone. I'm April Thompson.
I'm Alex Coleman. That nurse and health experts at Baptist Hospital are optimistic in the fight against the coronavirus.
So thankful that I was the first person that got the infusion in the Mid-South.
Registered nurse Andy Shepard is used to being on the front line in the fight against COVID-19. And he's there once again, becoming the first person locally to test a new COVID drug at Baptist Hospital that could be a game changer.
I'm a nurse by trade. I mean, I know that, and this has been widely studied, and the side effects are minimal, and I think the benefits far outweigh the risks.
Shepard believes he contracted COVID-19 after he and his family recently vacationed in Missouri. He was having a hard time breathing and lost his sense of taste, and this weekend heard about a COVID drug treatment at Baptist.
So anything that I can do to prevent, so I can be here for my family and take care of them long term, I thought I would try as an option, and luckily this came about.
Dr. Steve Threlkeld is an infectious disease specialist at Baptist Hospital.
Thanks, Alex. That's exactly right. This is the first, I think, regional dose, and really one of the first in the country, for bamlanivimab, which is the new monoclonal antibody that was approved for emergency use authorization from Lilly.
The COVID therapy has been for adults and children over age 12 with mild to moderate illness.
Basically, it's approved for people who are not requiring oxygen, who are not yet in the hospital. And the idea is that a trial has shown that this drug is successful at preventing people from getting sicker.
For now, Dr. Threlkeld and Andy Shepard remain optimistic.
I have a father that's in his 70s that's also a type 2 diabetic, and this gives me hope that it's, if he were to contract it, this is something that he could definitely have that may prevent him from going to the hospital.
It's great that Andy's done so well with it, and we'll be watching him carefully, and we'll be trying to put other people in touch with this therapy as we can. There are limited supplies right now.
And Dr. Threlkeld says they will be closely watching to see how the drug works for emergency use and in possibly helping other COVID patients.